Yes, thank you.
Great. And thank you, Merle, as well, and for Melanie for all your technical assistance. Let's hope my slides work. Um, and I'm feeling very honored, privileged to be here today talking to you all. Just very briefly to add to what Jonathan said, what's perhaps most important here is that I came for the first time to South Africa in 1994, just weeks after the first democratic elections. And I got to experience the birth of the new South Africa. And some of you weren't even born when I first came to South Africa. But I realize every time I connect with the NACCW, whether it's in person or virtually, that I've actually left a piece of myself in South Africa, and it's nice to revisit that part of myself. I've visited every province. I know your country better than I know mine because ours is so big here. I haven't had a chance to see as many areas as I did in South Africa. So it really is a pleasure to be here this morning talking to you. So I also want to say that we are talking about pain and trauma, but I want to emphasize today the notion of healing as we go along. Actually, it reminds me, there's a quote from Ernest Hemingway's book, Farewell to Arms. And it says, the world, all of us are broken by the world at some point, but some of us become stronger in the broken places. And I think what I'm trying to talk about today is the healing process, not just how we're broken, although it's important to remember the different ways that children come to us, but also to recognize that all of us in some way have been hurt by things that have happened in our lives. And sometimes those hurts become traumas which stay with us. And so that's the emphasis today is how do we move through the pain that we may be experiencing in different ways? How do we help others who are moving through their pain, whether it's family members or children we work with or our colleagues at work? You can be sure that most people have some area of pain that may not be as resolved as they would like it to be. So let's start. I'll see. Now, I'm not going to click on the link here because we tried it in a test and I lost my presentation for a while. So we have a tradition here in Canada to acknowledge the land of the traditional peoples on which we live. And I'm honored to live on the lands of the Lekwungen speaking people and the Wasanich tribes. And there are 4 First Nations on the peninsula where I live around Victoria. And I've learned a great deal from those with whom I've had the pleasure to meet. And I want to acknowledge with respect that I live on their traditional territories. Yesterday was Indigenous Peoples Day in Canada. So the radio and TV were full of stories and movies and interviews on First Nations people. Without going into a lot of detail, we had our own form of apartheid in Canada for 150 years. We removed children from their homes, placed them in residential schools, where many of these young people were abused emotionally, physically, culturally, spiritually, etc. So we have a lot to heal from in this country, and I want to acknowledge the hurt that has been experienced by our First Nations, Métis and Inuit people. And when I first came to South Africa, people said, oh, it's really nice to have somebody from a normal country. And I had to say, wait a minute, we're not quite as normal as you may think we are. So a lot of healing going on across our country at the moment. And I just want to acknowledge that. I also want to acknowledge that I heard just this last week from Larry Brentro that Dr. John Ceda had died from pancreatic cancer. I just want to tell a couple of stories about John. At one point, he was considered the most difficult child in Cleveland, Ohio, maybe the most difficult child in the state. He lived in, I think, 15 substitute care placements, including detention centers, mental health centers, and group homes and foster care over the first 12 years of his life. To say he was a troubled child is to understate what was going on. Um, and when he was 12, he was placed in the Star Commonwealth program where Dr. Larry Brenshaw worked. And they were able to connect, and many of the workers there were able to connect with John in a way that he hadn't connected with other people. He had many more years of difficulty after he left Star at 19, but the seeds had been planted for change. He went on to get his master's degree and doctorate in social work. He was then on a faculty of social work, and he published books, articles, and also his mission was to get children who had been living in the care system onto the boards of child welfare agencies to bring the lived experience of living in care into the operation of the agencies. And two of the favorite books that I've read are In Whose Best Interest and Growing Up in the Care of Strangers. So I remember I'll just tell you one quick story because the photo reminds me of it. We were driving from what's called the Black Hills Seminars in South Dakota to a ceremony at the Crazy Horse Memorial in the States. And on the way there, he told me the story. He said, Jim, you know, when I came out of detention, I didn't know how to smile. I don't know how many of you know, but if you smile in prison or jail, you're quite likely to be beaten up because people say, "What are you smiling about?" They take it very personally. So he told me that after he came out of those experiences, he had to relearn how to smile. And I think the picture on the screen shows you how well he learned how to smile. And he has a wife, Lori, and a daughter, Honora, who I'm sure are missing him terribly at the moment. He died fairly quickly from pancreatic cancer. So I wanted to just acknowledge his legacy to those of us, particularly in North America. He's had a very large influence. And I'd like to tell you another story from my own research. Um, it's a real privilege, as you can imagine, to be a researcher and to be able to spend time learning from other people, whether it's what they've written or whether it's practice-oriented work at different levels of the care system. And I wanted to set out to find out how did effective group care work. So I chose homes that everybody that I talked to felt were working well and where the children actually experienced positive change. And I spent about 14 months visiting these 10 homes any time of day or night. They gave me permission to just come in at breakfast time or bedtime or any time during the day. And it was a very powerful learning experience. And that's what my book was about that was mentioned earlier, Pain, Normality, and the Struggle for Congruence. One of the stories that was particularly interesting to me was a young boy who was 12 years old. And of course, I had to ask permission from everybody in the house. Everybody in the house, the staff and the children, had to agree to me doing my research there. And this 12-year-old boy, I asked to talk to him, and he said, okay. He said, so you want to talk to me to make places like this better for children like me? And I said, yes, that's my hope. He said, okay, I'll talk to you. And during the conversation, he told me many stories of his own journey. One of them was one day in the group home when he was coming downstairs on a Saturday morning, and he heard the two staff people, a man and a woman, in the kitchen arguing. And he said, I got very scared. And he sat down on the stairs and listened. And he could hear the voices. He wasn't quite sure what they were arguing about, but the voices were obviously disagreeing about something. And then that stopped. And he sat there for a while and he thought, okay, I'm going to go down and see what's happening. So he went into the kitchen, and one of the staff members said, oh, good morning. We have pancakes this morning and we have real maple syrup. Would you like some? And what he said to me was this: I realized then that there was a different way for a man and a woman to relate to each other. And I decided I wanted to treat women in this different way. There was a male and female staff member. This moment of respectful disagreement between the two staff members actually gave this child an experience that he would never forget, and that may have broken an intergenerational cycle of domestic violence. The reason I'm telling this story is that often as workers, we don't even know those moments where children are influenced by what we do. And this story shows that even the relationships between staff can plant seeds for children to change. So this boy had never seen two adults disagree without the man beating the woman. And he saw a different way by experiencing the staff. And I'm quite sure that the staff members did not even know this had happened. Because of confidentiality, I didn't share this story with any staff. I don't know if the same staff were even there when I visited the programs. But it showed me how a very everyday moment, two people who weren't even aware, perhaps, of what they're doing or the impact it has on children can make a difference. So sometimes the healing process can be very subtle. And what it speaks to is that all of us need to always be treating each other in ways that we want children to learn from. So just to start off with the first word in the title of my presentation, what is trauma anyway? And I'm sure you all have heard about trauma and have explored, have discussed trauma in various ways with other staff members or in training. But to me, a handy definition is trauma results from an event or a set of circumstances that is experienced, and this is a really important part, that is experienced by an individual or as physically or emotionally harmful and exceeds their ability to cope. So trauma is something that happens to us, or a series of things that happen to us that overwhelm our ability to make sense of it and to cope well with it, and it creates a residue. It has lasting adverse effects on an individual's well-being. So sometimes people overuse the term trauma, like, oh, I was really traumatized when that car almost hit me. Well, that's not really trauma. That's a frightening experience. Trauma is something that actually changes what goes on within you, and it has a residue. And that residue is pain, what is left within a person's body and mind. And it's both aspects. Sometimes you feel it physically, and other times you might not experience it physically, but it might be what I call psycho-emotional. So it tends to be both. And there is a book about trauma called The Body Keeps the Score, which makes the point that our body stores up that pain that results from the traumatic experiences in childhood. And sometimes it's just so much part of us, we hardly notice it. But at other times, it explodes. And we'll talk about that in a moment. So it affects our thinking, how we interpret the world and people. So someone who's been traumatized within their own family will be very hesitant to trust and be open with people in new families, in foster families, in group care. And for good reason, because to them, intimacy can be dangerous and can be painful. But it also affects our behavior. Not only the inner state gets triggered, but they may lash out. They may respond to the world in ways that we don't really understand. It seems to be disproportionate to what is going on at the time. So pain is very powerful. But what I found in my study of these 10 homes over 14 months was nobody was talking about pain. I don't know that I ever heard the word pain over that period of time. But clearly, the children, many of them, were going through episodes that were uh, very aggressive, very challenging. You can use all kinds of words. They appeared to be very dysregulated, and people were trying to manage or control their behavior, to respond to their behavior. Or sometimes they just reacted to their behavior, because if someone's swearing at you, calling you names, or maybe throwing things at you, it's very difficult to respond in a caring way. So I actually created the label pain-based behavior because I felt people were overlooking what lay behind the behavior. To be really effective in working with people in pain, we need to help them recognize their pain and to learn how to deal with this pain. And if we're not naming it, it's very difficult. So behavior is an indicator of what we should be understanding. And it will take us curiosity and compassion to actually earn the trust to learn from people where that pain is coming from, because it'll be difficult for people to talk about. But we should also remember that not all challenging behavior is pain-based. Sometimes we're just upset. Sometimes maybe the movie we expected to go to was canceled, or a parent called and just kind of said something that bothered us. So it may be that it's just a more normal range of being angry or upset or worried. But at the same time, not all pain-based behavior is challenging. We have to also recognize that children who withdraw, children who are quiet, children who perhaps don't challenge us also may be manifesting the behavior as a result of pain. And they may be self-harming. And some children actually, and I think there, to some degree, there seems to be a gender bias here in North America, that more of the girls will be withdrawn and more of the boys will be more aggressive or challenging. That's not always the case, but we should watch out for those quiet girls because they're suffering too. Now, I'm just going to mention one interesting piece of research called Adverse Childhood Experiences Research. And this was a study done that identified 10 adverse experiences that have a significant impact on children and adults. Um, and actually, these 10 experiences in childhood, traumatic experiences, actually can lead to not only dysfunction, but also to long-term negative health effects. And this study was done by the Kaiser Health Group in the United States. They have hundreds of thousands, I think, certainly tens and tens of thousands of people who are insured. And they got a sense that there was something going on where they could correlate certain experiences with long-term poor health outcomes. And they wanted to understand this so they could be more effective in helping people to not suffer long-term health impacts. So the first thing that they identified 10 things that they then went out and asked people about, and they gathered thousands and thousands of uh, pieces of data from the people in their sample. And one of the things that causes long-term adverse health impacts is physical abuse. And these things will be of no surprise to you, but it is interesting to see it, the research what the research shows about this. Sexual abuse, emotional abuse. So 3 forms of abuse that they identified, that they actually looked at the records of people and looked at their responses to questionnaires. Physical neglect and emotional neglect. So these 5 things, these 3 forms of abuse and 2 types of neglect, were things that they got feedback on from people in their health coverage. I also want to say there are many other forms of abuse and neglect, like cultural neglect. If people are removed from their culture and lose track of their identity, losses, people who die who are close to us. So there, and also traumatic natural events such as floods and fires, as you've probably heard about in Canada. We've had a lot of forest fires this year. People removed from their homes, children who experience their homes being burned to the ground, or perhaps a relative dies. So floods and famine and earthquakes and displacement. What's happening in Ukraine with 1.5 million children displaced within Ukraine or outside Ukraine. All of these things can have traumatic impacts. The other 5 were family mental illness. Having a close family member who has significant mental illness can have a negative impact on those who are actually not experiencing mental illness themselves. Having a relative, a close relative who's incarcerated in jail or prison. If your mother is treated violently, but I would say if anybody in your family is treated violently, you would have a traumatic response to that. If anybody in your family, especially close to you, is suffering from substance abuse, alcohol, drugs, whatever, that will have an impact. And finally, divorce. If your parents, so For many, many, many people, one or two or three of these things will be true. What the research shows is the more of these that you've experienced, the more likely you are to develop adverse adult health conditions, whether it's heart problems, blood pressure, um, severe arthritis, all kinds of chronic conditions can result from experiencing this kind of abuse. And I've done workshops where people at the end of this part of the presentation say, I'm a 10 out of 10. So some of the children you work with, and maybe some of you even have experienced 10 out of 10. And that means there's a lot of healing that has to happen in order to live the totally fulfilled life that we all want to have and to be successful and to experience joy in our lives on a regular basis. So, what is healing? There are several words I want to just take a moment to talk about. So, for me, healing implies a wound, and it kind of parallels the process of a physical wound. So, if you cut yourself, say you cut your skin with a knife by mistake when you're cooking or whatever, you put a Band-Aid on it, and the body heals itself. That's one of the miracles, I think, of human beings and animals, is that when they have wounds, if they don't get infected, if you keep them clean, they will heal themselves. However, psycho-emotional wounds don't tend to heal themselves. And there is a book called about the primal wound. And the primal wound is if you lose your mother early in life, it has a profound effect on you. And if you lose your mother at any time in life, it can have a profound effect. So for some, biological reason, biopsychosocial reason, our relationships with our mothers are particularly powerful. They're powerful with our fathers too, but somehow the mothering experience is something that seems to have its own particular biological force. Another term that's used is recovery. And the one problem with the word recovery is it implies that you're going back to a normal state that you once experienced or a healthy state that needs to be recovered. And in many cases, the young people we work with have been traumatized from a very early age, perhaps before they were born, in utero, as they say. So even before you're born, you can experience trauma if your parent is suffering abuse or is on drugs, and various other kinds of experiences can affect a newborn when they're born. They'll be carrying that with them. So what I've come up with is the notion of living forward. I think what we're doing with people who've experienced severe pain, and a lot of the children we've worked with, if not all of them, will have experienced deep and profound pain, senses of loss and abuse and neglect, is we're trying to help them find a way to live forward. We can't go back and change the past, and I don't think for many children it's recovering a state of bliss that they had before they were abused. For many of them, they may not have experienced a healthy, normal set of relationships from even when they were born or soon after they were born. And actually, I discovered, I said, there should be a word, not recovery, but pro-covery, and looking forward. And in fact, there is that word, and there is some research on pro-covery, sorry. How do you help people move forward? So that's what I really want to emphasize this morning is how do we help people move forward who've experienced deep and profound pain from various forms of trauma? So in this research that I did, one of the outcomes which really, really impressed me was I looked at all the positive interactions that occurred within group homes over a 14-month period. And I looked at everything, not just what were children experiencing in a positive way in the home, but what were their parents where they visited the home? What did I see there? What did I see recorded in logbooks? What stories did people tell me about the changes that were taking place? I interviewed children in care. I observed children in care. I put a lot of weight on what they told me about their experiences and what made a difference for them. And also between staff members and between managers and staff members. There are all kinds of interactions that take place, as you know, in a group care situation, thousands of interactions every day. And I recorded as much as I could in writing mainly because I didn't use a tape recorder except for interviews. I wrote down after my visits everything I saw and experienced by way of positive change. And when I analyzed it after, about 10 months, I started to analyze this data in detail. There were 11 different dynamics that could be found in all of these. At least one of these dynamics was present in any positive change experience. And sometimes two or three, or maybe more, were evident. But it to me, it was amazing that you could reduce all of the hundreds of and thousands of interactions over a day or month or a year in a group care situation, that if you focused on these 11 and you were able to do these things, you would create a caring, nurturing environment for those around you. So the first one is pretty basic: listening and responding with respect. And as I said earlier, if people are swearing at you or throwing things at you, it's very difficult to keep your cool and to respond with respect. But that's what good programs do. They look past the behavior and say, "You are looking really upset to me right now, and I'm wondering what's happening with you." Rather than telling them to stop behaving that way, why is this behavior happening? What is happening to you? What has happened to you? And by being responded to this way, people feel a sense of dignity and being valued. And it's an unusual experience for young people who lash out at adults to be responded to with this kind of respect and care. The second dynamic was communicating a framework. We all need to understand where we are and why we're here and what's going on around us. For staff members, they need to understand what it means to do a good job. They need supervisors or trainers who help them understand what they should be doing and whether they're doing it or not, and how to do it better. Young people need to understand, why am I in care? And many young people don't know why they're in care because no one's taken the time to explain to them what's going on. And we'll talk a little more about this later. Building rapport and relationships. I think if there's one word that sums up child and youth care practice, it's relationship. Some people say it's all about relationship. Without a strong, positive relationship with the children we work with and with our fellow staff members, we're not going to be able to be very effective with these young people. And it can be challenging to create that kind of relationship. And the reason I put in the word rapport was one of the programs that I studied only took children in for 3 days. So it was a short-term shelter program. But they said, we have to develop rapport with this child quickly because we only have them for maybe 1, 2, or 3 days. And we want to do what we can to help them on their journey, to help them find the next step, and to help them deal with whatever fears and worries and anxieties and traumas they're carrying with them, at least start that process of healing. So that gives people a sense of belonging and connectedness. Establishing structure, routine, and expectations. Many young people who come to us have not had right routine meals. They might not have ever been fed on time, or maybe they have to scrounge for food themselves. Maybe they've not been told when to go to bed, how to get a good night's sleep, all the kinds of things, how to dress yourself properly when you go out to school. All of these kinds of routines need to be part of a good response to people who've experienced deep and severe trauma. So the word inspiration to me is important. Inspiring commitment. I don't know how many young people I talk to who've actually found their path to healing, who said it was so and so who really impressed me, inspired me. It could be a football coach, it could be a childcare worker, it could be a social worker. Somebody in their life, a teacher, reached out to them and connected and inspired them to do things that they didn't think they were capable of. So we all need that sense of spirit, team spirit, inspiring adults around us. And that helps us develop a sense of loyalty and continuity in life.
Mm.
Number 6 is offering young people emotional and developmental support. We talk about emotional intelligence. We need to find ways to help communicate caring to young people so they can then begin to feel positive emotions. And that helps them to develop their own sense of caring and mastery. At the same time, when we have a strong positive relationship, whether it's with a colleague, somebody we supervise, another family member, or a child, at times we have to challenge people. Some behaviors are just not acceptable. And even though we look past the behavior, we need to help them learn that that behavior is not acceptable and to help them find other ways. So we have to challenge each other, but we can only do that really effectively if we have a positive emotional relationship with the other person. And I always say that at the heart of good supervision in a group care program is being supportively challenging. And I could tell you stories, but we don't have time, of my own development where a supervisor saw something in me, challenged me in a way that perhaps made me even a little angry at the time. But upon thinking about it, I realized they were absolutely right, that I wasn't doing the best I could do. And that challenge, because it was based on a respectful relationship, was something that made a difference to me and actually kept me in the field where I might have just left. Sharing power and decision making. This is a big one in the UN Convention. How do you help children participate? In the disability area, people say nothing about us without us. And I think that's a great principle for all of us. We should not be making decisions for other people without involving them in the process, and that goes for children as well. And it helps children develop their own sense of discernment and to think about their own sense of agency and personal power. Respecting personal space and time. And again, I can tell you some horror stories where that wasn't respected that were told to me by children. But, perhaps we need to talk to a child about a change in placement. Maybe they're going for a home visit, or maybe they're switching schools. It could be some significant change in their life, and that child may be very anxious and afraid. And when we raise the issue, they may push us away. And we can say things like, I can sense you don't really want to talk about it at this point. So I'll check in with you later and see if we can find a time when you are ready to talk about this. So we allow them some space to come closer to being able to deal with a difficult situation. I told you about the supervisor who challenging me. He challenged me. He saw potential in me that I didn't see in myself. And young people have so much potential. That's what's one of the wonderful things about working with children is their future is ahead of them. And there's so much in this world that they could enjoy and experience if we can help them to find that potential and to develop a sense of hope and opportunity within themselves. They can see life as having opportunities, not just sadness and chaos and hurt. And the last one, and there's a little picture of a boy fishing, and I purposely put that in because one of the children I interviewed in another home said, my very favorite, because I say, what was it like for you in the home? And he said, excuse me, it's early in the morning here. I need a coffee. Said my very favorite thing to do was go fishing with the head of the group home. And they would go fishing every couple of weeks, and to him it was bliss. And he said, so after about a year, he was transferring back home. They'd done a lot of work with the family, and he was ready to go. He'd learned some skills. And they said when they had a going away party for me, the manager of the home gave me a present, and it was a fishing rod. And he said that was the best present anybody had ever given me in my life. Because the manager had seen how much pleasure this boy got out of fishing, that he wanted to give them the ability to go fishing by himself after he left the group home. That's the kind of gift that helps children learn gratitude and generosity. If a child is starting to play in a basketball league for the first time, or baseball, or you don't have baseball in South Africa, but cricket or something, rugby, give them a new pair of shoes that they need to go and to play, say, basketball. And those kinds of gifts at timely moments have a very powerful impact on us. So if you reflect over these 11, these are the core changes or core differences that make a difference in a person's life and in developing a relationship. So the healing process, I reflected on my research, what I'd read, stories I've been told, my own life experience, and just actually, you're the first people to ever hear this because I developed this for this webinar. Um, the 12 steps of healing. And it's important to remember they don't necessarily all happen in sequence. It's a bit like the steps of coming to terms with grief after a loss. We don't all go through those steps in the same way or at the same time, but these are the components, the various elements, I think, of the healing process that maybe we need to be aware of and to be able to look for with the people we're working with. So, of course, the first step in helping people to heal from trauma is to stop the trauma. If a child's living in an abusive situation, they may need to be removed from that home. As difficult as leaving home can be, John Ceda, one of the things he wrote at the beginning of his book, In Whose Best Interest, was, it was absolutely the right thing to remove me from my family. He knew that that was necessary. Unfortunately, the responses to him after that were not highly successful in the first number of years of his life. However, he did reach a point where skilled workers could actually help him to begin to learn how to live with trauma and move past his trauma. But we must stop the trauma. If you're in an abusive situation, you can't heal until you remove yourself from that trauma. Then when we leave, we do need to live somewhere. We need to live in a safe space with caring and nurturing people and influences. So all of us need to live in a safe place. We have a right and a need to live in a safe place, and we need to create those safe places for the children with whom we live. And the 11 dynamics I mentioned earlier, I first wrote about these 20 years ago. I still have people telling me that those 11 dynamics are what they pay attention to, and it makes a huge difference in their program when people are doing these things on a regular basis. Some programs have even developed a tool where they have outsiders come in and observe them and give them feedback on to what degree they're actually doing these 11 things. Because sometimes we think we are responding with respect, or we think we are giving children space, but maybe in fact we're not doing it as regularly or as thoroughly as we need to. So we need caring, and those are, I think, important elements of caring. We also need to help people who've been traumatized to acknowledge what happened to them. This is part of that framework of understanding. How many children have you heard blame themselves for what happened in their families? They have a drug addicted parent or a mentally ill parent. The parents have fought, they've abused each other, other family members may have been abused, and children somehow feel that they're responsible for being removed from their families. We have to help them understand that you're not the problem. You need to accept that you are a worthy person and things happen to you which were very unfortunate and very harmful. And we're here to work with you to help uh, live forward, how to move ahead with your life so that those kinds of experiences don't control you and don't hurt you all the time. So people need to be honest. They need to learn how to share their stories, and they need a trusted or competent adult to talk to. Um, this is so important. We all know that trust is critical. And at the beginning, most young people who've been traumatized will not trust adults. And they may have been through, like John, 15 different placements where people did not respond to them well. They were not trustworthy adults. And so we're going to have to earn that trust. We have to be trustworthy. And we're going to have to experience a lot of adverse behaviors before we're going to be able to create that kind of sense of trust with the children we work with or with other workers or family members. So then people need to explore and understand the process of their pain. Um, so not only this is what happened to me, but this is how it works. This is how it's affected my behavior, how I feel when I'm in new situations, how I how I respond to those around me. They need to get a better sense of that. And they need to learn to be open to new, normal, and healthy experiences. When you haven't lived in a very normal or when you've lived in a very dysfunctional context, it takes a while to actually trust and to open up to new and different experiences. That story I told you about the boy sitting on the stairs listening to the two workers arguing and then discovering that the man didn't beat the woman as a result. That was a moment where he experienced a normal, healthy relationship, and it had a profound experience on him. And I think may have changed the course of not only his life, but the rest of his family if he was married and had children. It could have broken that cycle. And it is a struggle. We need to help people realize this is difficult. This is not going to happen quickly. Life is a marathon, not a sprint. And we're here to help you build the skills that you can carry forward with you, even when you're not living here with us, or when you're not in this program, or when you move away. We want to help you because it's probably a never ending thing. An alcoholic will tell you, once an alcoholic, always an alcoholic. It's always a struggle to stay sober. And you hear people saying, I've been sober for 3 years or 5 years or 8 years with great pride, because it is indeed a struggle. And then I think we also have to learn to welcome and honor and celebrate the steps. A lot of the steps that people take are very small, and they might, as we say here, poo-poo them. They might say that was really nothing. Well, wait a minute, it was something. You acted differently yesterday when we went and engaged with those folks. In the past, I think you would have struck the person who said that to you. I saw you turn away and walk away. That is a big step, and we should celebrate that. You're beginning to learn to control those emotions, that anger that comes up when it comes up. And we need to help people celebrate that. Some steps are big, many of them are small, but small can be every healing journey begins with a single step, and we need to help children recognize those steps, no matter how minor they may seem to them at the time. And lastly, I think, well, it's not quite last, I've got one more, but um, the 11th stage is to stay in safe places with caring people, caring and trustworthy people. Um, we all need to live with surroundings that promote our well-being and that help us to be what we're capable of being. We should not allow ourselves to be dragged down, to be hurt continuously by the people around us. So we have to help children find those places. And as you all know, it's very, very difficult to do these days with the way our care systems are set up. But that's another webinar to talk about how we change systems. So lastly, the 12 stages, repeat the above steps as necessary. There will be setbacks. Sometimes it's 2 steps forward, 1 step back. Sometimes it's 1 step forward, 2 steps back. But if we know the different elements of change, and we can help children to deal with whatever's happening in the moment, we can help them, regain that sense of being on a journey of healing. So I just want to put this all another way. I'm getting close to the end now, and I really look forward to hearing comments and questions and having a bit of a dialogue. Another way of looking at experiencing childhood trauma is that some of the basic assumptions that can help us to engage the world in a positive way are shattered. So let me just give you the 3 main assumptions. One is the world is good. For many people, the world is a horrible place. Family is a horrible place. Families mean hurt. They mean pain. Going to school is painful. I'm abused verbally, emotionally, maybe culturally. What do you mean the world is good? The world's a horrible place, and it hurts me every day. Life is meaningful. Do children have a sense of purpose? Do they have a sense that there is a future that they can help to create? Or do they feel the whole life is just chaotic, and perhaps the best way out is to commit suicide or to harm myself, so at least I won't feel the emotional pain, I'll feel some physical pain instead. I can deal with that. I can deal with the physical pain, but I'm overwhelmed by the psycho-emotional pain that I'm experiencing. So a lot of self-harm is to try and have a focus for the pain that is inside them. How do we help children develop a sense that life is meaningful and that they do have a purpose? And the last assumption that can be shattered is that I am a worthy person. If people treat you like dirt, if people abuse you and neglect you, emotionally label you as a dummy or as a no good, or you'll never amount to anything, all these kinds of messages that can come to us in a dysfunctional situation eats away at our self-esteem, eats away at the sense that we're a worthy person, that we actually have a right to feel good, a right to live in a healthy way, to be respected, to be cared for, to be loved. And interesting about love is that people have studied love, but they don't call it love. So one example is some of you if you've done psychology, you may have heard of Carl Rogers, who developed an approach to counseling. And he talks about unconditional positive regard. Everybody needs to experience unconditional positive regard from at least one other person. He initially called it love, and his colleagues told him, you can't really be a psychologist and publish talking about love. So he created the concept of unconditional positive regard, but he was really looking at love. I only found out recently that John Bowlby, who developed attachment theory, initially he talked about love and how children can experience love. But again, he couldn't publish in those days and have it published if he was talking about researching love. It was too wishy-washy for professional psychologists and researchers. So he came up with the notion of attachment, but he was really looking at love. So these days, we're now feeling more free to talk about love. How do we create the conditions within which children feel loved? How do we create policies that will shape the services we have so that within those services, children can experience love? We can't legislate love, but we can legislate the conditions within which love may be more likely to happen if we have healthy programs, well-funded programs, well-resourced programs, well-trained staff, people supervised to deal with their own trauma so they don't just inflict it on the children. All of these elements of good care can create the conditions within which love can happen. So we want to help children. They may never again feel that the world is really good, but they may say there are some good people and there are some good places in life, and I want to meet people like that, and I want to live in places like that. It may not be life isn't always positively meaningful to me. I think there's a lot of things in the world that are very disturbing, whether it's war, displacement, floods, you name it. There are things we can't really explain, or we can explain and are very unfortunate. But overall, I've been lucky enough to feel that I can create a space for myself to do meaningful things, that I can fulfill a purpose that's positive. I can help other people. We all need some sort of foothold where this kind of inner belief exists. And lastly, we need to have children feel. So those of you who watched the webinar with Heather Maudlin, I happened to watch her webinar also, and she told a story about a child who had been very disruptive, and when he was placed in their program, she started to turn around and to be very positive and to give off positive behaviors, not pain-based behaviors, but positive behaviors. And the doctor who was seeing her said, "Something's changed. What's going on? What's it like in this home that you're living in?" And she said, "Oh, doctor, they really love me." So that's how we begin to feel worthy as a human being. So I'm at the end of the content, but I want to also acknowledge Lilia Zaharieva. I'm dedicating this presentation to her because she helped me learn a great deal about pain and the process of healing. She was removed from her family when she was 14 after being abused in different ways. And she lived in care until she was 19. Eventually, she made her way went to studied philosophy at university because she was a very intelligent woman, but then decided it wasn't. How do you become a professional philosopher and get a job as a philosopher? It's not very easy. So she ended up coming into child and youth care, and she was a student of mine in my first year class. And after a year, I hired her as a research assistant, and we actually wrote some articles together and edited a special issue of a journal. And we did a workshop together. This photograph is the two of us after the workshop we did at a national child and youth care conference, talking about trauma, pain, and healing from the inside out and from the outside in. So she was the person talking from the inside out. She had lived in care. She had lived with trauma, and she had lived the process of healing to a certain degree. I had worked with children in care, but I was coming from the outside of their pain and trying to understand from a care worker's perspective how I could be more effective in supporting young people to heal and to live forward. And so I really wanted, unfortunately, a year ago, last Saturday was the first anniversary of her suicide. She had grown up with many of those adverse childhood experiences, and one of the most troubling was her mother was seriously mentally ill. And I think Lilia always feared that she too would suffer from the same mental illness. And I don't know exactly the conditions under which she took her own life. There was no one with her at the time, but I have a sense that she started to fear that she was going to suffer the same fate as her mother, who was living in a group home for mentally ill people. I don't know what happened, but she was a wonderful human being, affected everyone around her in positive ways. She also had cystic fibrosis. And ironically, had been placed on a drug which was actually helping her to live normally like she'd never lived before. It was a genetic treatment, very expensive, but she was able to access this drug that was actually giving her a sense of hope and future. And it may even be that she wasn't prepared to deal with success to the degree, and she had lived all her life knowing she was going to die in her 30s. In fact, a doctor had told her, you probably won't live past 30 or 35. I don't know to what degree those messages played a role. But I get a little choked up because she was a woman with such potential and had contributed so much in her short life. I want to dedicate this presentation to her. So I talked about coming to South Africa in 1994. I've been back and forth. I don't know how many times, maybe 15 to 20 times. Thanks to the NACCW who invite me from time to time. And you can see some of the wonderful people that I've met. Brian Gannon at the first conference in 1985 in Cape Town. Don Matera, what a lovely man. I was so sad when he died, but he lives on in my heart, and I have his books. I read his poetry. An amazing human being who was he was the kind of child who keeps us in the field, because look what kind of man he became after he found people, healthy adults who treated him according to those 11 interactional dynamics. Of course, the NACCW leadership, Donald and Zenny, who are out hopefully getting more resources for NACCW as we speak. Merle, of course. Thank you, Merle, for being here today and for always being there for me. Ashley Theron, Barrington, some North Americans, mainly Canadians. You seem to like Canadians. Jack Phelan, Tom Garfat, and others who've come. And of course, Nelson Mandela's house. I remember visiting his house in Soweto. And I mean, where on earth would you find two people living a couple of blocks apart in a shanty town who would win Nobel Prizes? Only in South Africa. So thank you very much. I hope what I presented today might be somewhat useful in your own thinking. Thinking about yourself and thinking about your families and thinking about those children with whom you work and your colleagues. Which of your colleagues may be in pain right now who need these kinds of responses to their hurt? So it's a difficult topic to talk about pain and hurt, but I hope I presented some signs of hope. Thank you very much. Now I need a little coffee.
Thank you very much, Jim. I can see that people are clapping hands there in the distance and applauding. Thank you very much for those who have listened and participated here with us this afternoon. Going forward, we will now open up for questions and comments. But from my side, I also want to say thank you already for sharing with us and paying tribute to the late John Ceda in terms of his contribution to the child and youth care field. There is a question there in the chat box, Jim. Some people ask, where can they purchase these books? Growing up in care with strangers, and in whose best interest that you have. Maybe you could respond on that one.
Yeah, I'm not sure if you can access services like Amazon in South Africa or other. There are many bookshops around the world that will do orders. I'm trying to remember now. There's a kind of thrift books, I think it's called, where I get a lot of used books because they're a lot cheaper if you buy a used copy, and I can't always afford new copies of all the. I probably average a new book a day. One day I even bought 35 books, but that's another story.
Sure.
So I love books because I learned if I get one good idea from a book, it's worth it. And so John's books are available, I think, secondhand as well as new through online services. I'm not sure what you can access easily from South Africa. But In Whose Best Interest is a story of his healing journey, and it's told with two childcare workers who actually worked with him at the STAR Commonwealth program. A lot of good insights on how to help young people heal. And Growing Up in the Care of Strangers is a book, I think 11 different children who grew up in care, who have masters or PhDs. So many of them have become researchers and have studied growing up in care, not only lived it, but studied it. And so they talk about what they've learned from their own experience as well as from hundreds of other young people who've lived in care. And the final lesson I remember from that book, Growing Up in the Care of Strangers, is that what matters is not where you live, whether it's a foster home or a group home or a kinship care or in your own family. What's important is how you live. So sometimes a group care situation is the best place for a young person who has very complex trauma, and they can learn to heal themselves with help. So that is a very interesting book from that perspective. But I think In Whose Best Interest may be the book to start with. Yeah. So if you need a reference or something, I could give more details. But I think if you Google In Whose Best Interest John Ceda, Seita, you'll find it'll come up.
Thank you, Jim, for sharing these resources with us. I think people did see somehow that we could connect with, you say, Amazon, if we Google or go onto the internet in that regard. Yeah. I don't see any questions here in the chat box, just people who show their appreciation and saying thank you for you sharing with us in your calm and professional manner and teaching us some new valuable knowledge and skills and things that we should focus on. I especially like the word that you've shared, the concept of pre-recovery, that we don't look at a recovery going back to an old way, but looking forward in terms of bringing healing to those who have experienced trauma and other problems. Sorry.
I saw that Merle had her hand up.
Okay, Merle, if you could just take over. I just want to switch off my phone here.
Thank you, Chair. I just wanted to ask a question, and I think that this is possibly a question, Jim, that you get asked all over the world, but it is perhaps particularly relevant to us here in South Africa. I mean, you say that the way for children to heal is to first stop the trauma and then for them to live in a safe space. And I think
Mo, are you with us?
I am.
You just lost you for a while.
Okay.
I can hear you fine, Merle.
Okay,
okay.
thank you. And I know that we in our child and youth care centers often and in community-based programs feel that we can't stop the community trauma that young people experience. And even if children go back to live in their families, they're often not that safe. And I don't think that that's something that is unique to us, but it's certainly something that I think we struggle with. And I wondered how you respond to that in terms of how do we work with children who we care for and keep safe and invest so much in, and then we let them go out of our care, and yet we seem to be letting them go to such a dangerous world. So just wanted to ask your opinion of that.
That's a very good question, Merle, and I appreciate it. And I'm so glad that I had the opportunity to visit several of your safe parks, the Izabindi program in different parts of the country. And I think the answer I would give is that we give the children experiences of safety for a period of time, an experience of living with trusted adults for a period of time, being treated with respect and feeling worthy for a period of time. So I'm thinking of Izabindi. I mean, those children may be living in communities that are quite dangerous, where their safety is at risk every day. There may be predators, there may be all kinds of things happening within the community. However, I think what I've learned is that if the child can have I kind of use the term beachheads. It's a term that was used in the book called The Other 23 Hours, which was written by Larry Brentrow, Al Trishman, and James Whitaker. And they talk about relationship beachheads. In other words, can we give the child an experience of something different that is positive? And so the safe park is a place where they can go.
Mr. Chair, are you there?
We lost the sound there.
I've also lost sound. Maybe we've all lost sound. Eddie is saying, yes, we've all lost sound. It seems as if Jim has perhaps been disconnected. Elwin, are you there? We've lost Elwin too. I think we can just give it a few moments and see if Jim is able to reconnect.
Can you hear me now?
Yes, we can.
Okay, somehow I got cut off. It just went black. I'm sorry.
Okay, thank you. We're thrilled to have you back.
Well, just to finish, I think we're creating these opportunities for a child to experience life differently and to feel at least some people are safe and where they can go for support and where they can hold with them that sense of relationship that's positive. So you're right, we can't change the world around them to any great degree. As much as possible, we need to help them live in a safe space. But having one or more safe adults around them can I think give them that sort of bridge till they can find a space that is much more positive and healthy for them. So to try and keep them from danger. But as you could see, I mean, I wasn't the therapist for Lilia Zaharieva. We were co-researchers, but she had a therapist working with her and she was making progress. But even after all that, she took her own life. So there are sometimes limits to the healing that happens for people. But we do our best, to help them learn what they need to learn to find safe places to live and to live in a healthy way. I don't know if I can say much more than that, but I still think forming those positive relationships and creating some spaces, maybe helping them feel more at home at school, so when they spend their day there, they feel fairly safe at school, because often that is the refuge for people who have a dangerous home life or community. That I don't anything you would want to add, Merle, to that?
Yeah, I think that's a very helpful response, actually, Jim, because I think sometimes we feel so overwhelmed, and I guess also when one lets a child go, as it were, responsible for how they're going to experience the world. And what I hear you saying is connect them to resources that are safe, and people that are respectful, and that's as much as we can possibly do in an imperfect world, I think. There is a question in the chat. I don't know, Elwin, are you back?
Yes, Mel. Yes, I'm around.
Okay. There's a question in the chat box. I don't know if you can see it.
I can't see it at the moment. No.
This you're talking about this one from Mpumalanga.
Yes.
Yeah. Yes. Let me read for you, Jim. My question is, how can you help us in the Department of Social Development in Mpumalanga, Swartfontein Treatment Center, where we work with children and adults who are abusing substance? We wish to improve our skills. We wish that you can meet with our superiors to arrange such webinars for child and youth care workers. Sounds like it's more for us as NACCW as well, but maybe, Jim, you could also respond.
Well, I'm certainly always willing to meet with people who wanted to talk about healing and how to be more effective, in child and youth care work. I'm not an expert on substance abuse in particular. That's not my area of research. I'm aware, of course, of a lot of the programs that do try and deal with substance abuse. But what I tried to present today was what I think is a foundation of any program that's helping people heal, whether it's from substance abuse or emotional upset or whatever, physical trauma. Those are the sort of fundamental ingredients, if you will. And I think we'd have to look at each context, to say, how does it apply in this context? I would suspect it might be different in Mpumalanga from the Eastern Cape or the Northern Cape. There may be different social conditions, different networks, different resources. So I don't pretend to have quick answers to those kinds of complex questions, but I'm always happy to be part of a dialogue around, and to use the expertise of those who are working day to day in those contexts.
Yeah, and I think our webinars are also open for everybody. Those working in child and youth care centers, you're welcome to forward, the link and the invites to your managers or whoever, so that they could also be part of what we present here. Yeah, thank you very much. And then I saw Francisco's hand was up. Francisco, maybe you also want to comment or pose a question.
Good morning, Jim.
Good morning. How are you?
All right, thanks. Thanks for the opportunity. I was just sort of making a statement, but you might want to guide us on this. In our particular case, we've got two 13-year-olds who are cutting, and they are on a lot of medication at the moment. And the challenge in the children's homes for us would be that the ratios are very big. It ranges from 1 to 10, 1 to 12, 1 to 14. So one child in youth care worker for 14 children. And so inevitably what you're dealing with here is a child who's cutting, who needs more attention and more specialist care. And then you sit with the rest of the group lagging behind. And so that would become problematic in our children's home settings. What's your take on that?
Well, I mean, you need more workers, clearly. That ratio is not conducive to individualized, personalized care and response. We know that. Are there other people, though? I'd ask the question, are there other people in that child's network that we could work with and help be healing agents as well, whether it's teachers, soccer coaches, neighbors, aunts, uncles, siblings? You know, in many cases in South Africa, I saw older siblings were the most powerful support for the younger siblings. If the older siblings felt healthy and felt confident, and often Isabindi, I think, was trying to do that, to strengthen the ability of older children in a family to support the younger children, because that was the reality of child-headed households. So I don't think there's a magic bullet, but I think the ratio of 1 to 14 or 1 to 10 is not enough to do the intensive care day to day that we'd want to do. You still can do the best you can with what you've got, and perhaps some of the children will connect in a way that will lead them on that path to healing. But clearly, I think you need probably more resources, whether it's outside the program or inside the program or both, to manage that. It's a very, very challenging task, I understand, to work with that size of group. And the research shows that having more of a 1 to 2 or 1 to 3 or 4 ratio is far more effective. Unfortunately, I know that's not the reality for many programs.
Thanks for your response.
Yes. Thank you, Jim. And as you have shared with us in the process of moving forward, that we also need to have this structures and facilities where we can, provide this care, healing. I just noticed from when I made the notes, I think you said there's 12 steps, but I think between 5 and 6 and 4, 5 and 6, maybe we've missed one. Somebody did comment on that early on.
That wasn't a test. I wasn't trying to see who was paying attention. Whatever I put up there is what I meant to put up there. Maybe I numbered them incorrectly. I'm sorry if I did. I was just reflecting on that this morning as I was waiting for this webinar, that I had, there are 10 adverse experiences. There were 11 interactional dynamics and 12 steps of healing. I don't think that meant it. Whether it's 11 or 10 or 12, I think those were some of the major components. I'm sure somebody else could come up with a 20-stage process if they wanted to break it down even further.
Yeah, thanks. Then I see here from Eddie. Eddie asked, where can we access more of your work on trauma or pain-based care? Jim? Well,
again, I have the book, Pain, Normality, and the Struggle for Congruence. But what I'd recommend, and perhaps NACCW could get some copies. There's a new book out by Martha Holden, and it's a third edition of her work on care. And what she's done is broadened a program that was developed. It uses quite a bit of my research in developing a program for residential care. But what they've learned is the principles and dynamics and the practices that are identified also are effective in foster care situations, and I would say in even home family situations. So there seem to be some dynamics of care, some of which I identify in my own research, that actually can be helpful in almost any caregiving situation. And that book goes a lot more depth into practice. My book was more the research and the components or the elements of an effective group care situation. But what Martha's done is taken that and moved it into a lot more discussion of the dynamics, the actual practices that one needs to engage in, the attitudes and the behaviors that staff need to demonstrate in order to help children to heal. So I would strongly recommend this book, and it's just been out in the last couple of months, I think, and it's published by the Child Welfare League of America, and it is in paperback, so it's not as costly as some books would be new, because I don't think you'll find used copies yet. But it's just called Care Edition 3, and it's important. It's edition 3 is a lot more meaty than the first two editions. You might find used copies of Care early editions, which would be good, but this one would be the best. So it's the Child Welfare League of America. You could probably order the books from them. And even if your agency could order one copy and then share it with all the staff members to read, as they're ready to read it, or people could develop workshops based on the material in this book. It's one of the best I've seen on a comprehensive approach to responding to children with complex needs.
Thank you for sharing that information, Jim. There's somebody that just asked that you hold up the book again.
Yes,
you can see the.
So I can't see myself, so I can't really see if I'm holding it correctly. Just a second. Anyway, it's called Create Care, 3rd edition, Creating the Conditions for Change is the subtitle. There we go. And it's Martha Holden, Holden. She's at Cornell University. In fact, I'm going to be going there on Sunday for a week to meet with people who are implementing the care program around the world. So it's a model, it's a way of approaching care for children. But I think even if you don't adopt the whole model of care that Cornell developed, I think there are a lot of good insights into the care process.
Yeah. I'm just.
No, it's posted on the chat group. Good, thank you.
Yes. Mel, are there any other comments that you perhaps have noticed?
Yes, Chair. I see that there's another hand.
Yeah, I can't see the hand. Maybe you could ask the person to respond.
I don't know if there's a person behind that hand who would like to ask a question.
Yes. Yes. I'm behind the head. It's Nicholas.
Thank you.
Yes, it's Nicholas Nkululeko Nkosi. I'm from South Africa, Mpumalanga, working in Swarfontein Treatment Center, where we work with people with substance use disorder. First, I would like to welcome the presentation from Jim. Thanks, Chair Elwin. Thanks for organizing such an event. My take here is that we need more of these as child and youth care workers in Mpumalanga, mostly in Department of Social Development, because we feel not recognized in most cases. So this type of presentation from Jim, we need more of it. That's why I've written on the chat to say, I don't know if NACCW can connect or can consult with our department so that they can arrange such things wherein we can be in groups to attend to this, because we are affected in most cases, because when we when we treat children with trauma and pain and whatever, it end up affecting us, most of their traumatic experiences, because most of those who are using substances, they've been through a lot of trauma. Then when they share with us, we end up being part of, like, we need care as well as care workers. Thanks for that. Thanks for the presentation. I hope I will in future be part of it. Thanks. It's educative, it's informative. Thanks, Jim. Thanks, Elwin. Thanks, Marlon. Thanks, all of you. Thanks, guys.
Thank you for your comments, and we all need these opportunities to be inspired and to be challenged, to keep learning and to keep supporting. And as you say, when we work with people who've been severely traumatized, it affects us too. You know, we have that secondary trauma that we need to deal with, and in order not to burn out, we need people around us who will support us also. So thank you for that.
Yeah. Yes, thank you. Thank you for the comments. And I just want to say, somebody did ask, will we receive more invites? And we have planned that we have on a monthly basis that we would like to have these webinars. And we're grateful that we could, that Jim could find time in his busy program and his research and traveling to also make time for us here as the NACCW. But we're part of his family, as he so shared with us all the collage of all the photos that he've gathered. Thank you very much for that, Jim. I just want to check again if are there anyone else that want to pose a question or comment. I'm just looking here to see if there's any hands. I don't see hands here raised. You are welcome to put your questions. Let's make use of the time that Jim has given us. Even if you would like to share your own little experiences or stories, you are welcome. So that we...
I think Zenny's joined us.
Oh, yes, I see now Zenny's hand is up. Zenny, welcome. And you
Thank
are also
you.
welcome to share with us, make a comment.
Yes, I just wanted to say thank you very much to Jim for getting up so early and being with us. I know you might have said this already, and I unfortunately had an urgent government meeting, and so I couldn't be here. But it's so good to see you on the screen, and it seems like it was a useful, vibrant, and important time for our people who have joined in. So just wanted to just say something and to say a big thank you, Jim. Very appreciated.
It's great to hear your voice, Zenny, and I think about you often, and the notion of intentionality. I'm hoping today that one of the things that Zenny discovered through her PhD thesis was the key role of intentionality in child and youth work. That everything we do has an intention. We don't just hang out with people with no motive or no goal. We're actually trying to create safe spaces and trusting relationships. And I'm hoping that my presentation today might have added to the intentionality of some of the work of those of you who were listening, because I need reminders myself periodically to be more intentional in everything that I do. So Zenny, I've learned a lot from you, Zenny, too. So thank you.
Thank you.
Well, Jim, it looks like most people are just sharing all their appreciation. I think you have put together for us in terms of this presentation a step-by-step approach. And as you have mentioned, that the process moving forward and the 12 steps of healing, we shouldn't be stuck on 12 or 10, but it's that we embrace those things that can be done as we are dealing with those that have experienced pain and trauma in their lives and how we should react. I think what have been shared here is sometimes we don't look at those big disasters sometimes around us, maybe where children experience their houses burned down, there was a big fire, or the divorce that they're going through. the sickness of their adults who must care for them, all those things, and how we should help them to engage and share their stories, creating the nurturing environment. Yeah, I think we are blessed today, and we've received so many that we can put into our toolbox as child and youth care workers in terms of the concepts and strategies. The takeaways that we going away from here are tremendous. But my task is not to do the vote of thanks as such. Before we then, I just want to quickly browse through the chat box again and see if there's any other questions that have come up. There's just some comment here from Catherine McMillan. I also wanted to say children were impacted here in COVID lockdowns and families fell apart. And now we are seeing that pain. That is a comment here from Catherine. Before we then do the vote of thanks, I'm not sure, Mel, or is there any other questions? Francisco, comments from the leadership?
Well, if I may, I think
Continue, Francisco.
you can go, Mo, it's fine.
No, you after you.
Yeah, thank you. Thank you for the opportunity. I think we are extremely blessed on this side, to be able to join and to hear some valuable information, because it affects us every day. It's like the other gentleman from up north said, working in this space, at the end of the day, you sometimes feel that you need a lot of these counseling as well. And indeed, it is like that. And so we've got to put in mechanisms, to try and help ourselves, basically, to deal with the kind of traumatic experiences that's underlying in most of the child and youth care staff, or anybody working in children's homes or in this kind of sector. It cannot be taken for granted that we are okay, because the fact that we work in a space where children are traumatized means we carry that load. And so you have highlighted quite a number of points for us to consider. I love what you said is that we can't legislate love. We can't legislate love, but we can change the conditions to help children feel loved. And I think the same applies to us. Thank you for that particular quote, Jim. I feel that I've learned a lot, and I can certainly share with a lot of my staff members who unfortunately, again, could not be part of this because we're dealing with some other internal issues. And again, the child is at the forefront, and you've got to always pay attention to that. But we can certainly, get the recording and also the slides that you have presented today. So again, thanks for getting up so early. And for sharing with us your knowledge. We really appreciate that.
Thank you, Francisco. And I want to say, Elwin, too, you're a master at summary. I really appreciate how you sum things up. Thank you.
Yes, we just want to allow Merle also, because Francisco and Merle was bumping into each other. Merle?
Thank you. And actually, I'm following on from Francisco, so it worked out very well, because I was just so impressed by your points, Jim, where you said the world is good, life is meaningful, and self, you yourself is worthy, and that those are the impressions that young people should get about life, and that those are healing steps. And I was thinking in terms of creating the conditions in child and youth care centers where, like, for instance, the colleague from Mpumalanga who said how difficult the work is, that how we have to create as child and youth care centers a sense that the world is good, that the work is meaningful, and that you as a child and youth care worker are worthy. And I think those are often the experiences that our child and youth care workers don't have. And that's what we've got to really try to turn around, especially in the field of residential care, which carries with it its own particular traumas for for people who are working with children who are experiencing pain on an ongoing basis. So I thought that was a very useful way of thinking about it. So thank you very much for that.
Yes. Jim, before we close, we just want to give our chairperson from the Free State, Josie, the chance to do the official vote of thanks. And then after that, we're going to allow Jim just to say some closing remarks before we then say our goodbyes. Josie, Pinawa?
Quiet. Good afternoon, everyone.
Afternoon.
Good afternoon. I think we are moving now on a very, very high speed. The presentations become better, more exciting every time, and we're really looking forward for the next one. Professor Jim, thank you very much. As you heard here, everyone is very grateful. Everyone in our presentation, thank you very much on behalf of NACCW International, national here in South Africa, from Kimberley here in the Northern Cape. We appreciate the effort that you put in, to do research and to prepare everything just for us today. I heard that you mentioned that it is the first time that you present this presentation, and we highly very much for everything. And then I also want to say thank you very much for NACCW national leadership for the effort that they put in to make this. Thank you very much. Thank you for all child and youth care workers that tune in. I noticed that almost 70 or more than 70 devices tuned in today, and I'm sure that some of them are sitting in group. Thank you that you tune in. Thank you that you might be part of this presentation. I really hope that we will use the information and implement it, as child and youth care workers. Thank you very much, everyone. May you have a blessed day. Thank you.
Thank you, Josie. I really appreciate those words. Thank you very much. And I loved my visit to the Northern Cape. A lot of interesting people up there, a lot of good work being done. Thank you.
Yes, thank you, Jim. I'm not sure if there's any last comments from your side before we do say our goodbyes.
Well, just to want to underline the fact that a part of my heart is always in South Africa, and it does feel like family whenever I come together with NACCW. Whether I've met people before or not, you're part of my extended family, and I thank you for this opportunity to have a family reunion. Thank you.
Yes,
Thank
yes.
you.
Thank you. We're glad that we've got family there far away in Canada that's always thinking about us, and that we can connect in this manner. So on behalf of the National Association of Childcare Workers and the National Executive and our directors and all those that have joined us this afternoon, we want to again express our appreciation and gratitude for you participating in this wonderful opportunity that we can learn from each other, and that we are taking the best interest of our children at heart. As I've said earlier on, we have these seminars on a monthly basis, and we will post to our structures, our regional, provincial PEC structures, that we will then inform those to participate, and also on our website that who's and when we will have our webinars. And so we appreciate you and we thank you. And as we're going towards our afternoon, going to close our day of work. I think Jim's day will start going forward. And we want to say thank you also for getting up so early to be part of us in this live presentation. Thank you once again. And on that note, we want to close then this session and say goodbye. Goodbye, Jim. Keep well.
You too. Bye, everyone.
Bye-bye.
Bye-bye. Goodbye. Thank you. Bye.